I'm going to discuss some other parts of Medicare Advantage plans. So we talked about HMO, talked about PPO. There's also a program called a Chronic Special Needs Plan, and that tends to be an HMO as well. But a Chronic Special Needs Plan is an individual that has a chronic special need, i.e., diabetes, cardiovascular disease, or chronic, cardiovascular disease or COPD, or chronic obstructive pulmonary disease, or chronic asthma. And under those conditions, the insurance companies have a pre-authorization, or not a pre-authorization, but they have a form you fill out that states that you answer some medical questions that states that you have been told by a doctor that those conditions exist. And then there's also medication that you're taking that validates that those conditions are present. And the doctor signs off on that and gets you qualified for that particular plan. So myself or one of my team members would sign you up for one of those plans, and then the forms would go to your doctor, and they'd sign off on them that you have that condition. And so that's what's called a chronic special needs plan. Now the next topic would be a dual plan, and that word comes up a lot. You might hear it in advertisement, or DSNP plan, a dual special needs plan. A dual special needs plan is somebody with limited income and resources, and a dual special needs plan means that the client has a form of Medicaid along with Medicare, and they get a plan that coordinates with both. And why one would do this is because, typically speaking, on a Medicaid plan, you can only see Medicaid doctors. On a Medicare, you can see Medicare doctors. And so this gives the best of both worlds. You get a plan that you get to see doctors that accept both, and a private insurance company through a Medicare Advantage plan. Now, for the most part, it's going to be an HMO. We do have a PPO as well in Florida, but in HMO, you still have a primary doctor that would have to refer you to specialists. And these chronic special needs are the dual special needs plans. They may show a premium, but the premium is actually paid by the state of Florida in this instance. And then depending on your level of Medicaid determines what your copays would be. If you have the highest level of Medicaid, QMB plus, then more than likely you wouldn't have any copays. You might have a little bit of copays on medication based on your low income subsidy levels, but it's a very small amount. All the other services would be zero. So the chronic special needs plans and the dual special needs plans obviously have qualifications we just discussed. The dual plans will require you to apply through the Department of Children and Family Services the Medicare Savings Plan to get your level of Medicaid, and to make sure the state comes and picks up your Part B premium as well. And then, of course, also cross-references into low-income subsidies so you can get your medication at a reduced rate and avoid the coverage gap or donut hole. And a lot of these dual plans offer some additional benefits, usually higher OTC benefits, higher comprehensive dental benefits, higher amounts available for glasses, and things of that nature. So there are some advantages to taking that step and going to a dual plan. And that just basically concludes our discussion on other types of plans related to Medicare Advantage. Thanks for your time.
Thank you for watching this video. There's more to learn from our library of resources on the website MedicarePlansForUs.com. The link is in the description box below. If you would like to learn how you can get your questions answered by our Medicare specialist at no cost to you, click the link in the description box to get started today. Visit the description box for more tips on cutting your out-of-pocket Medicare costs from the Medigap Supplement headquarters,